Studio. We're pleased to welcome now Mike Chaney, the Commissioner of the Mississippi Insurance Department, also serves as the State Fire Marshal. Commissioner, good to see you, sir. Thanks for coming in.
Always a pleasure to be here, Gerard.
All right, so first give us a little update. What's going on in your world in the Department of Insurance? What are you guys working on?
Well, you know, sometimes I tell people I feel like a goose. I wake up in a different world every day with what goes on in the insurance business. But there's a lot of things that are happening now with open enrollment on Medicare. Affects a lot of Mississippians, especially our elderly population, of which I happen to be one of them. And what's happening is Medicare Advantage plans are plans that are sold by private industry for the government. It's a very profitable business for them. And these private insurance companies are counseling hospitals and networks and doctors and taking them out of network. So people that have bought the plans lose their doctor they normally have been seeing. They lose the drug coverage if you got a Part D, which is really drug coverage. Mm-hmm. And they have to go back to regular Medicare. And when you do that, you may be rated based upon your health. So it's some real issues for us. And we've got some guidance from CMS is coming down hopefully this week, some new guidance with open enrollment being like it is. So it's open enrollment, by the way, started on the 15th of October, and it will end on December the 7th for people that want to get on Medicare for January the 1st. So for the public that's listening, that's kind of where we are.
Explain to the audience, because it's kind of a confusing situation, exactly what open enrollment is and why you need to be aware of that short period of time.
So when you turn 65, you're automatically enrolled in Part A of Medicare, but you have 6 months to buy what we call a Part B. If you're already still continue working, you'll automatically enroll in Part A, but your Part B may be covered by your own health insurance. If it's not, if you've already retired, then you have to buy a Part B or you're penalized forever. There's no, you can't, sins are not forgiven. So you buy a Part B, and that would be covering the Medigap. And Medigap is just covering the difference between your deductible and what you would normally pay out of pocket. And it provides you for your visits to the doctor. Part A covers hospital. Part B covers doctor's visits and drugs, and et cetera. So you buy usually a Medicare Part D, which will cover your drugs. Mm-hmm. I read somewhere, I can't remember the exact quote, said you court all of these other Medicare Advantage and all the other Medicare plans, but you really date and stay married to your Medigap policies. That's important to know. Keep your Medigap. Don't let it drop. So it covers your drug costs. Some people choose to go back with Medicare Advantage. If you get rated because of health, then you got to pay a higher premium.
Yeah. Well, they keep making that more and more complicated, and ain't no doubt about that. And Medicare, of course, as you know, is got some financial headwinds it's facing as well. And we just don't see a lot of discussion of that at the federal level. But the trust fund folks say, we don't think we can make Part A payments by 2028 in full.
I think 12, maybe. I'm trying to remember when Phil Bryant was elected governor in 2011, and in 2012 he asked me to go to DeSoto County to the Chamber of Commerce meeting, about 450 people in the chamber, and talk about Medicare. And I said, look, this is what's happening. Every person that's employed or self-employed is paid 2.9%. Either they pay half and the employer pays the other half, or you pay 2.9% if you're self-employed. That's for Medicare. So it's a retirement type system for health care. Mm-hmm. And what has happened under the Affordable Care Act, the PPACA, the federal government has taken a lot of those trust funds and they've used them to give tax credits. So they rob Peter to pay Paul. It's just bottom line. And they took from one pot of money, if you want to say it that way, and moved it to another pot of money, or from one pocket to another. And they have basically bankrupted the trust fund. It's good to probably 2036. If you think about it, that's about 10 or 12 years from now. Depends on how you want to do your math.
Well, they're saying Part A, they can't make full payments by 2028.
2020. Well, you've got better updated news. And
Part A.
Part A. That's horrible.
Yeah.
They've taken our money and used it somewhere else.
Well, but you also probably, I don't know, you may not be aware of this, that about 40% of Medicare is now funded with general fund revenue.
I wasn't aware of that.
Yeah, so we're having a subsidized Medicare essentially over and above the trust fund and the payments, both in terms of premiums and active employed people that are paying into it. That's what's supposed to cover the benefits. That's not enough. So some of our general fund revenues, about 40% of total Medicare, is coming from general fund now.
And when you look at all the tax credits that will be given out through 2025, that has not been renewed. And that brings up, we don't really know what the health care plans are for either one of the presidential candidates. And I've already voted, so I can say that I'm a Republican. So it makes life kind of hard when you're trying to be a regulator. Yeah. And figure out how you take care of the consumers of the state. That's our main goal in life, is to protect the consumer and make sure companies are solvent and they can pay the claims. Yeah.
All right, so give us an update on Mississippi establishing its own exchange for the Affordable Care Act plans. That you proposed this. We got this passed by the legislature. The governor did not sign it, as I understand it. Is that correct?
The governor did not sign the bill. It was proposed by Trey Lamar and the Speaker of the House. They passed it. We worked with them on the conference reports. We got a very, very good bill that would allow us to establish a state-based exchange. Would not cost any money to start it up out of the general fund. We've got a bucket full of money that's over in the high-risk pool that we've been holding on to for 10 or 12 years. And that would be used to start up state-based exchange. But CMS has told me and has told the legislature they would require a letter from the governor for us to establish a state-based exchange. Since I am elected, I probably could go against the governor's wishes. I don't think politically that's a wise thing to do. You've got to work with these folks. And unfortunately, the governor has not made a decision, and we've asked him to do one back in April. I hadn't pushed him because we've got until the end of 2025 to get everything up and running, which we could do. And that decision will probably be made after the November elections, and we know who the new president's going to be, and kind of an idea of where we're headed on those health policies that they were probably signing into law or propose, I guess, in January and February.
So just to update our audience, Mississippi is one of several states who relies on the federal government to operate its exchange of the policies through the Affordable Care Act. And some states have brought that in-house, essentially. And so what we would gain by that is we're paying fees for that to the federal government.
We are paying out about somewhere between $25 and $35 million a year. So we'd make that much money that would stay in the state, and then you could use that money to either lower premiums for the people in the state, or you could use that money to offer other ancillary products like dental and health and hearing and eye. So there are a lot of options for us to use that money. What you don't want to do is use the money for buying new pickup trucks for folks and all the other things that government normally does. It's strictly for health care.
Yeah. Well, has the governor provided you with any reasoning for him not being in support of this at this point?
He has not.
Okay.
And I have talked to some of his staff. I haven't talked to Governor Reeves personally since back in January.
Okay. Well, that's fair enough. I just was curious if
they're looking at it and they'll review it. And basically what they're saying is, look, we don't want to make a decision until after the election.
Okay.
And then we may not make one then, and then you can do what you want to do. And at that point, I have the option as the commissioner to go in and say to CMS, you can't tell us we can't have a state-based exchange.
Yeah.
Legally, they cannot.
Okay.
And if that happens, then we'll go down the road, and I'll probably end up suing CMS for somewhere around $1 billion because that's what we're losing every year.
Wow.
And CSRs, that's cost share reductions.
Yep.
So there's a lot that goes on. It's a very complicated issue, but it's really very simple. It's about money.
Yeah.
And health care.
I got it. Makes sense. So something that you had sent me some info on is this PBM world, the pharmacy benefit managers, which are sort of middlemen is how they're referred to between the pharmaceutical makers and the patients themselves, and then the pharmacy retailers, et cetera. We got a break right now, but if you can hang around on the other side of this, we'll dig into that. We got Commissioner of Insurance Mike Chaney in the Element Wealth studio. Visiting with Mike Chaney, the Commissioner of the Mississippi Insurance Department, also serves as the State Fire Marshal. So before we went to break there, Commissioner, this pharmacy benefit manager deal is extremely complicated. I've had, Robert Dozier, who's the executive director of the Independent Pharmacy Association here in the state, extremely knowledgeable of this matter. I don't know that anybody could fully explain how the pharmacy benefit manager system works. You go online and you looked it up, and if you went to the images tab under Google and you see these flowcharts that depict the relationship of all the parties involved in the distribution of drugs and the retail sale and the manufacturing and everything in between of drugs, it's unbelievable how complicated that is.
It's extremely complicated, and when you look at the flow charts, it's always about money and power.
Yeah.
So a pharmacy benefit manager never touches a drug. They're the in between the manufacturer, which is Big Pharma, and then the local consumer, who normally would go through his local pharmacist. And by the way, we ought to talk about this sometime on your show. Local pharmacists are endangered. There was an article that I read recently that just said that probably a third in Mississippi will close within the next 24 months if something's not done on the dispensing fees. But here's how a pharmacy benefit manager works. They're supposed to be the negotiator for prices, and they set the prices between the manufacturer and the local pharmacist. And they set the formularies of what is covered by your insurance company. So 80% of all the PBMs are owned by Cigna, which is Walgreens, Aetna, which is CVS, or Optimum, which is United Healthcare. And then if you throw in the other 10%, it would be the people like the Blue Crosses Association that use that one particular one. And then you've got the outlier, which is Mark Cuban, who has his own, the billionaire, has his own PBM.
Yeah.
And he formed it to try to cut costs and found out he can make a lot of money. So I don't know where they are. But the bottom line is, who pays for it? You and I and everybody that takes a drug of some sort. Drugs are 40% of your premium cost for health care. So if you're paying $1,400 a month for a family and you're working independently as a self-employed person, think of this. Almost half of that is due to drug cost. And it's not your local pharmacist. It is due to the PBMs. I don't care how you cut it. PBMs are in between. They started out to be good for the industry, but they've turned out to be bad. Not all of them are bad. There are some still good ones. And when you do your research by every state, some states have laws. And by the way, Mississippi is one of 3 states that does not have the management of PBMs under the Commissioner of Insurance. It looks like I may get it because they keep telling me they've got legislation coming in 2025.
I didn't know that.
And that's a good reason to have an appointed position and not political, so you can do the right thing. There are a lot of good laws. West Virginia got ahead of the curve on how to control the costs, and they've done a fairly good job. Wisconsin's got a good law. We're looking at what's happening in Georgia. My good friend John King has the same problem. The difference is in Mississippi, nobody can tell you what a drug costs. But in these states where they have decent laws like West Virginia, Wisconsin, Georgia, some of them, you can tell what a drug costs. I looked them up, and I've got a book on drug costs that stays current if we want to look at it. But what we're trying to get a handle around is, what do you tell a local pharmacist that calls you and says, Commissioner, what does this drug cost? I said, I can't tell you. That's not in my purview. I'm in the insurance business of regulated insurance, and you're in the business of selling drugs, and we're trying to help you. But you can't even sell a drug. A local pharmacist can't even sell a drug at a profit of even $1 on some of the state health plan drugs that are prescribed. It's horrible.
Yeah, very complicated.
So I will tell you, I'm going to write an op-ed. It should be out this week on PBMs. It won't be. I'm not bad-mouthing folks. I'm just saying this is a bottom line. This is why things cost what they cost, and the state has got to do something. Our dispensing fees go from less than $4 to some states are up at $10.89. I don't know how they come up with these odd numbers. I'd just make it an even number if I were in the business. And some of them go as high as $12 per drug. if you do 100,000 scripts a year, that's not a lot of money. That'll cover your overhead, and you make a little profit and a decent living. And the problem is the legislature doesn't understand it. It's very complicated.
Yeah, it is,
and I don't understand it either.
I think you'd have to have 2 or 3 people assembled in a room with some expertise to really understand it fully. It's a little concerning, though, that we may end up, I would think, based on the threat, the headwinds that many of these independent pharmacies are facing, with some areas in the state where we just have pharmacy deserts.
I think we're going to have that. Especially in the Delta part of the state and along the river counties. Vicksburg and Natchez will probably survive, but you look at Claiborne County, they may have an independent pharmacist, but they won't be able to sell the drugs that you need because they'll lose a lot of money, and that's what you got to take care of. I don't know what you do. I know what I would do. I was talking with the speaker last week briefly, and I said, first thing you do is make your local pharmacist whole. The second thing that you do is to try to figure out how you can have a coalition of 12 states, and that's basically what we're working on, to say that if you mess with Oklahoma or Arkansas, you're messing with Mississippi on drug costs, and that could bring down the drug cost.
Well, we've already got the national chains. Many of them are closing stores as well. They're announcing
Walgreens has 8,600 stores, and they're closing a lot of them. Rite Aid closed about 800 or 900 of theirs. CVS is in the same throes of trying to change theirs. They just changed CEOs last Friday.
Sure did.
And that's a big deal.
Yeah.
I got my flu shot at CVS because the Walgreens line was about a mile long and CVS was short.
Man. Wow. All right, so talk some more about your advocacy for no longer or just eliminating the election, I should say, of the insurance commissioner.
Well, 44 states appoint their insurance commissioner in various ways, and I'm proposing that the state of Mississippi eliminate the election of the insurance commissioner, state fire marshal, that it be an appointed position, that it would be appointed for either 4 or 6 years in the second year of a governor's term, so they have time to have a year under their belt. They're not elected to office trying to pick out somebody, and you have some really strict qualifications to say that you've got to know a little bit about insurance, you got to know a little bit about business, and a whole lot of issues. And it would be a safeguard, and if you decide to run for a higher office, you got to resign.
Yeah, that makes sense.
That's what Alabama does. Alabama had the same problem. It becomes political. And the reason is that somebody in special interest that's going to try to buy this job, they tried to do it in 2007. That's the sole reason I got into the position of running for insurance commissioner, and here I am as commissioner. I'm the second longest serving commissioner in the country right now, and probably in January I'll be the longest serving insurance commissioner, and I'm advocating for doing away with the election and making it an appointed position. What happens then is you take politics out of the arena. As an example, on the Gulf Coast, if you want to go down and do mitigation, you're not going to have to fight special interest groups that want to keep insurance rates high. Mitigation lowers them by 40% if you do it correctly. You're not going to end up into the problems of assignment of benefits like you ended up in Florida. And by the way, Florida's 3 years ago had a group of trial lawyers that tried to get their job reelected so they could elect a trial lawyer to be insurance commissioner, and they could continue suing on assignment of benefits. And most of that is basically roof coverage, where they would get $200,000 or $300,000 for a $20,000 roof through legal fees. And the courts were awarding them those monies, Gerard. It's just crazy.
Well, and by the way, the conversion of the election of an insurance commissioner to the appointment, that's not blazing new trails, right, Commissioner? That this exists in other states.
It is not. In Mississippi, we already appoint the banking commissioner. We appoint the Department of Revenue. We appoint the head of the Commission for Workers' Comp.
Yeah.
And all we're proposing is we kind of follow that suit, but I have a caveat. We won't send it confirmation, so you don't have a wild card of somebody said, well, what about a different party being elected as governor and appointing a different commissioner? I said, that's a moot question.
Yeah.
So,
have them go through a Senate hearing and get confirmed.
You got your Senate confirmation. You got a check and balance.
Yeah.
And you'll end up with a better qualified person. And when you have an appointed position, you have a larger field of qualified individuals.
Yeah.
The problem you have is if you're going to run for this job, you got to go out and raise $1.5 million.
Yeah. Should be focusing on regulating the insurance markets, in my view. So
I agree. You shouldn't take the money from the people you have to regulate.
All right. Good to see you, Commissioner. Thanks for coming in. Appreciate it.
Always a pleasure. Enjoy this show. Thank you, Gerard.
We're coming right back in the Element Wealth studio.